This show is sponsored by Jackie Mahali Photography, where personal branding photography and video help women entrepreneurs over 40 feel confident, beautiful, and seen. Start getting paid what you're worth. JackieMahali.com when it's time to elevate your brand and your image. Hey everybody, I'm Jill Conway and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. I'm hoping you will be inspired to pursue your own dreams, reclaim your voice, and discover your strengths. So my guest today is Dr. Stephanie Cooper. She is a top plastic surgeon here in New York, specializing in breast reconstruction, and she does so much more than that. So Stephanie, welcome to the show and thank you for coming on.
Hello, thank you for the invitation.
Oh, you're very welcome. And I loved having you. I loved when I met you and we had a wonderful
We
conversation.
clicked right away.
We did. So now I want to share you with the world. So let's talk about your profession, exactly what you do. We'll go from there.
I am a plastic and reconstructive surgeon. I am the 13th board certified female plastic surgeon in all of New York. So, definitely went through the ringer to get there.
Mm-hmm.
And I think also by virtue of the fact that I'm a female, women would come to me for, corrective surgery, if they had breast reconstruction, or, if they just felt unattractive and after having children, after losing a lot of weight, and they just felt more comfortable with me because I was a woman, and and I have 3 kids, and I could totally relate to what they were going through. And so I had an office on 80th and Park for 20 years. I worked with my father. That was a blessing.
I didn't know that.
He was my mentor. He was a plastic surgeon, and he passed, and I just continued on in the city. And back in about 6 years ago, I was moving to Florida. I was shutting everything down. Kids launched.
Mm-hmm.
I'm good. And then about a month before I was supposed to leave, my mom had a heart attack. And everyone knows nowadays we need medical advocates.
Mm.
So, we need someone who can help navigate through the morass that is medicine nowadays.
Mm-hmm. Yeah.
So I stayed. And Dr. Greenberg was looking for someone to join him. And I had an OR in my office. I had payroll, I hired, I fired, and took care of all that. Didn't want to do that anymore because for me, the business end of plastic surgery is not the fun part. The fun part is actually performing the surgeries, meeting the patients, interacting with them. So it was an ideal situation for me and, got hired on the spot, and it's been amazing.
Wow, that is amazing. So you don't even feel like Florida is still calling you, or it is in a little way?
Maybe I'll be a surgical snowbird. I don't know. But right now I'm happy.
Yeah, yeah. And how's
So
mom?
mom is good.
That's good.
Thank
That's good.
God.
Yeah.
So I think also one of the messages that I think is important for us to get across to women who are either, have their established careers or thinking about going into a career that maybe is male dominated. You can have it all. I raised 3 successful children by myself as a single mom. There's a lot of reconfiguring with the schedule. And, I used to joke with my friends who worked, you know, mothers who don't work, they don't like it when the kids are home for the summer. And the working moms, we don't like it when they go back to school because there's just a constant reconfiguring of the schedule. But it is possible. And it just takes a lot of determination. It takes resilience, resourcefulness. And I'm here to tell you ladies, pick what your dream is and make it happen.
Did you do it with help? I mean, how did you do it as you said, single mom, a demanding
My
career?
my clinic patient's sister became my babysitter.
Oh, that's funny. That's funny. That's good. Well, you have to trust people, right? Yeah.
I did. I had my parents lived on the next block, and I gave my mom the key, and she would just walk in randomly.
That's
And
great.
but every time she walked in, our babysitter was rocking and singing to my kids. So
Hmm.
I was really fortunate.
Yeah. Oh, that's wonderful. So let's talk about your career. You know, did you always want to be a doctor? Was that always something? What did you want to
Always,
be? Oh, wow.
always. And, and it's funny because then when you go to medical school and then you start, doing your rotations, you're like a kid in a candy store. And for me, I initially thought I was going to be a pediatric oncologist because I had done rotations in pediatrics. I was a candy striper at Lenox Hill when I was a teenager, and I worked on the pediatrics floor. And, and then when started my residency, I thought I was going to be a neurosurgeon. And, because I really loved working with the attendings in the neurosurgery division at Michael Reese in Chicago. And one of them took me aside and said, don't pick your profession because you love working with us. Pick your profession because it's going to be something that you want to do. And, bitten by the
Mm.
plastic surgery bug because I love the idea of being able to invent my own procedures. Such a dynamic field, and I've seen so many changes. I've been doing plastics, if you don't include my 3-year residency, since 1997. So I've
Wow.
seen a lot of the changes over the years.
Right.
And, and for plastic surgery, literally we can work from the top of the scalp to the tips of the toes, and no two sides are even the same. So,
Mm.
I'm always in the operating room, reinventing, replanning, reconfiguring. And that's also why I love revision breast reconstruction, because I never know what I'm going to encounter until I get into the operating room. And the idea that I could give these patients the closure that they need and that they deserve, is that's the best thing ever.
Well, wait,
And
let me ask you, what is revision? What does that mean?
it's when a patient has surgery previously
Mhm.
and their results are either awful or they're
Mhm.
unhappy with the results. They've had a lot of complications, and it does happen a lot with revision breast, with breast reconstruction. And one of the things at that meeting, at that event that where I met you,
Mhm.
one of the things that was kind of annoying to me was, when one of the surgeons said, well, we put implants in under the
Mm.
skin flap, and it's less pain. And I literally went up to the patient after the meeting and I just said to her, please don't do that.
Wow.
Because, to me, it's a lazy way of doing it. And, and over the last 2 months, I've gotten the opportunity to revise several patients who underwent that procedure. And maybe it looks great for 6 months, but it's not a sustainable result. The sustainable result really is, not knocking technology,
Sure.
but sometimes the sustainable best results are the tried and true ones that we've been doing for decades. And, so for me, I had one patient where she had gone to Memorial. She had 19 procedures.
Wow. Wow.
And, when I see you, she's in my Instagram,
Mhm.
and I was amazed that they said to her, and of course, all male surgeons, because they don't look at things the same way we do. And they basically said to her, there's nothing more we could do. And when we were wheeling her into the operating room, I said to her, I promise you're going to throw away your chicken cutlets. Those are the things that
Yeah, of
women
course.
put into their bras to even out the breasts. And you know what? She did.
Wow. Let me ask you that question. Does most women don't have even breasts though, right? Do they?
100% are asymmetric.
Okay.
And 100%, I mean, it depends. For example, everyone has one breast that's wider, one breast that's narrower,
Mhm.
one fold that's different from the other. That I can correct
Mm.
with like breast reduction. Very seldomly with breast reduction am I actually removing the same amount of tissue. And that's actually a funny story too, because
Yeah.
I had a patient who, and for me being a woman, I've come up with my own procedure on, for breast reduction because
Mm.
I've only done like over 5,000 of them.
Wow.
And
Only 5,000. Only
that's
5.
all.
Only 5,000.
I think
Yeah.
I might be up to like 5,200 now.
Wow.
But,
Wow.
I can't do anything about one breast that's wider, but I'm so OCD when it comes to my surgeries. I can't have one fold here and the other fold there. That would drive me crazy. So I try and even out the breast as much as I can. So I had this one patient. I was trying to preserve her nipples because everything is about, preservation of the blood supply to the nipple. So I staged her because her breasts were so huge. So I got them as even as I could with the stage procedure. And then when I went back in to remove the same amount of breast tissue, the second stage, I removed the exact same amount of breast tissue from both sides because I had already evened them out. And that was
Wow.
the first time that's ever happened to me.
Wow. This is interesting, 'cause this conversation, because I feel like I've never had any type of breast reconstruction or anything like that, breast surgeries. So let's ask these questions. Do most people, when you do surgeries, do I mean, do you always take off the nipple? Do you remove the
Never.
nipple? And
Never.
never.
I
What?
think the number of times I've done that in my entire career, and I had to
Right.
because the breasts were so huge, there was no way I was going to be able to. It's called free nipple graft breast reconstruction,
Wow.
and I think I've done like 4 of them in my entire career because I always try and figure out what I could do with the anatomy presented to me, and that's how I came up with my own procedure,
Right.
where the blood supply is coming from 2 different sites. So I'm always very conscious of scar placement of, a lot of times I've seen patients who have breast reductions
Mm.
and they're cut all the way across their backs. I mean, that's
Wow.
insane. You hide the scars. And I always tell my patients, I want you to wear a halter and a V-neck,
Right.
after the surgery. If I created more scars, because I think just overall with plastic surgery, I think it should be liberating. There's nothing that I should do to make you have to think twice about the clothing that you're wearing.
Mm. Mm. It's so interesting. When I met you, and it was at a big a women's event, and so much of the conversation I feel like went towards surgeries and whatnot, and that sometimes in our society, women are made to feel shameful that they got work done, or they're overly done, let's say, or maybe, yeah, they've gone back more times than maybe they should have or something, or didn't
Right.
have the right surgeon. I don't know if it's more times, right? But what do you comment to that when the society kind of says, "Oh, like, whoa, she got so much work done." Like, who cares, right?
Oh, I think the best reason for a patient to have surgery is because she wants it.
Right.
Within that realm, it is up to the surgeon to say, no, you've had enough,
Mm.
or that's not. Because I've turned patients down because they had unrealistic expectations. You know, Making your breasts perkier is not going to get you a boyfriend. You
Right.
have to kind of work on issues that you might have, and you have to refocus.
Mm.
And in the same respect, the men and the boyfriends don't get to dictate what the patients want, because I've had patients come in with their husbands and their boyfriends, and the boyfriends are paying for the surgery, so they feel like they can dictate
Wow.
what I'm going to do. And I usually say to them, I'm not talking to you, I'm talking to her. And I had a
Wow.
patient, oh my gosh, this was like 20 years ago. And I had a patient, I had done a breast augmentation on her, and she looked great. She would look great. 6 months later, she comes in and she says to me, I really want the implants out. And I do forge a bond with my patients. They tell me secrets, they tell me everything. I become like their buddy.
Sure.
And she said her boyfriend didn't like them. So I told her, lose the boyfriend. And if you still want the implants out in 6 months, we'll talk.
Yeah.
Well, she lost the boyfriend. She came back 6 months later and said, thank you. I love them.
Wow. Wow. I know we rely so much on other people. What's the concern? And there was a concern with different types of implants and
Mhm.
things like that. What are the most common ones used now and the safest ones used now?
The only ones that we're using now are round and, they're smooth shelled implants. And it's funny that I'm glad you brought that up because to me, I remember when the textured implants came into vogue. And for me, everything I do has to make sense to me.
Mm-hmm.
Sometimes the papers will teach me something or will change my idea of things, but very rarely does it do that. So when these textured implants came out, they were thought to be anatomic and they looked more like breasts. But, I think I might have put two in 20
Mm.
years ago because, I was like, that's what the patient wanted. That's what I
Mm-hmm.
did. And I didn't like them because the textured implants don't move. And they look and then there was like an old paper that came out where they used zero radiograms, and I don't even think they do that anymore. But they were looking at what happens to the shape of the textured implants versus the round smooth implants when the patient is moving, when the patient is standing. It turns out that the round smooth implants were more anatomic. And
Mm.
that's how I always saw it. Because when the patient lies down, the implants weren't sticking straight up. They moved with the patient.
Oh.
They flat when the patient stood up, a little more of the gel went inferiorly. So it's just to me, it was always more. It just made more sense. Now the problem is that recently it was noted that the textured implants could cause lymphoma.
Mm. Wow.
And so now we tell our patients, check your implant card and make sure that you don't have textured implants. Those must come out. The old silicone implants that we
Mm.
put in, if it's more than 10 years old, you should get it changed out because the old silicone implants were awful. Nowadays, we're using the gummy bears and they're fantastic. It's cohesive gel. Very rarely do they rupture. And and I've had patients who say, well, I went to this doctor and that doctor, and they said, I have to change these new implants out every 10 years. You don't. That's
Mm.
just that's a wallet biopsy and it just worries the patients. Yes, you get monitored. Like we'll send patients for like an MRI just to make sure the implant is okay. Like 5 years, you could send them at 10 years. But you know what? If it ain't broke, don't fix it. You leave it
Right.
alone.
Right. Well, what is inside of the implants? Has that changed? It's still
It's
a
it's a different, it's a different polymer of the silicone,
hmm.
so it's more cohesive. It's not gooey and disgusting. In
Okay.
the old implants, the new implants, the shell has changed too.
Hmm.
I remember taking the old implants out from patients, and even if the implant was intact, there was still some goo on the outside of the implant, which told me that the old implants, the silicone that they used at the time definitely leached out into the tissue. So those I would absolutely get taken out.
Wow. Wow.
And and taking them out is not like a big procedure. We use really small incisions. We could use the old incision. There's a thing called a funnel, which enables us to do implants through an incision that's like an inch wide.
wow. Wow. So what's the most popular, surgery nowadays for plastic
I
surgery?
would say, it's like liposuction, breast augmentation. Very,
Yeah.
very. And you know what's so funny also? Now we're getting more men who
Ooh,
are getting, 25 to 30% of patients now are men
really?
because
God.
they get liposuction, men who develop breasts, it could be genetic. Most of the time, they never find out why. Um, you know, Men who smoke a lot of marijuana, they can develop breasts too. It's actually kind of interesting. So it turns out.
Oh, we're making news right now. I didn't know this. So go
Oh, it's
ahead.
very cool. So it turns out that that the carrier, because the metabolites for marijuana are metabolized in the liver. The protein carrier that takes the metabolites into the liver compete. The marijuana competes with estrogen because men have estrogen in them too.
Sure. Hmm.
And what happens is marijuana wins, and the estrogen is it, is sent back into the system and circulates. So heavy marijuana smokers can develop breasts.
Wow. Oh my goodness. I had no
All
idea
these
about.
little
Yeah.
factoids.
Yeah. I love this conversation. So, what I have to think, like, you do a lot of, obviously, post, women who have, gotten their breasts removed. Do you do that as well for cancer and, post cancer?
I don't do a lot of immediate ones, only because now with the advent of microsurgery, I don't do that.
Mhm.
If someone wants an immediate reconstruction with an implant, and I think, that also really depends upon the breast surgeon that
Yeah.
they go to.
Mhm.
You know, older school breast surgeons, sometimes they'll even say to the patients, "Oh, you don't need a breast reconstruction."
Right.
And I've seen that. Like I've done breast recons on women who had their mastectomies 20 years ago, and they had no idea that they could actually be made whole again. And I sort of attribute that, it's almost like the hero effect. When, and they were mostly males, male breast surgeons.
Mm.
And so when they take care of the breast cancer and the patient doesn't have breast cancer anymore, they are the heroes. But now they're sharing, but now if someone wants a breast reconstruction, they have to share that, they share that hero responsibility. So now the plastic surgeon who made the woman whole and gave her closure now becomes the hero. And I really think it does emanate, to, it emanates from that to some extent. Younger breast surgeons, they're more aware. And, because of social media, women women are more aware. So, women nowadays will say, "Well, I want a breast reconstruction."
Right.
But
Well,
in the
as before,
past,
you almost, like, years ago, it was like, "Oh, you don't need one, right? That's
yeah,
vain," or
they
whatever.
brush it off. Yeah, you don't need breasts. Oh,
Right.
okay.
Right. Exactly. Well, I mean, and you can do it for how many years post? Like,
Doesn't matter.
any, so 30 years or anything like that?
I did a breast reconstruction. She's actually on my Instagram too. She had her mastectomy, I think like 25 years ago,
Yeah.
and she was really misshapen,
Mm.
and I gave her breasts.
That's
So she
something.
threw away her chicken cutlets. She could wear what she wants. She can go braless if she wants. It is really nice.
I was gonna say that's gotta be such an emotional, journey at that point where
Yeah,
you have, you're traumatized by not having your breasts done, right? And being then told that you don't need it, and now so many years later, they're like, "No, of course you can have it. No matter what your age, you can get it done."
absolutely. And I think
Yeah.
also, it's such a strange thing for women to go through because, like part of our femininity are our breasts, and
Mm.
they're being told, "Oh, you don't need them."
Right.
So that doesn't make it so that, by definition, that would make a woman feel less feminine.
Right.
So, that just doesn't make sense to me. I think that everyone should have the opportunity to have breast reconstruction if they want. And I'll tell you another funny like a breast reconstruction story. So what I used to do when, because this was before the advent of tattooing of the nipples and nipple areolas. And, and the practitioners who do the tattoos, they're remarkable. You don't have to have surgery anymore because, the nipples are not functioning anyway. They're just there.
Mhm.
So what I used to do, this is, years ago when we didn't have tattoo. So what I would do is I would I would throw in a cosmetic procedure for the patients when I brought them back to surgery to do their nipple areola complex recons.
Mm.
So on this one patient, she had a double reconstruction. At the time, we were doing trams, where you took the skin and the fat from the belly attached to the muscle, you brought it up, and you recreated a breast. So she wanted her upper and lower lids done. So, I'm frugal. I don't throw anything away. And I saved her upper lid and lower lid skin and used it to make her areolas. This
Wow.
is a skin graft.
Yeah.
So I was like, why not? It's perfect.
Oh my goodness. Well, what's the average length of, surgery like that? I mean, or Your typical surgery?
With the trams, it was a double tram, and I actually did it with a broken thumb.
Oh gosh,
So
Stephanie.
they'd bring in iced saline for me. I'd dunk my gloved hand into the sterile iced saline, ice it for a few minutes, and then go back to my surgery. But, they don't do trams anymore. I think the micro cases, when they first started doing them, they were starting to do those when I was a plastics resident in 97, 95, 97. And they were taking 12 hours. It was pretty unbelievable because the technology is so advanced now. And now I think they can actually do them in like 4, 5, 6 hours.
Wow.
So it's pretty incredible.
Wow. How do you handle women who have poor self-image when they come to you? You must be like a therapist at some point.
I am.
Yeah.
Well, I have my master's in psych, but
Mhm.
no, I think that you have to be compassionate and kind. And I do spend a lot of time with my patients in consultation. If you look at my reviews, it's like you meet her and you want to go out for drinks with her. She becomes your buddy. I give them my cell phone so they can always contact me because, when we're doing the initial consult,
Mm.
there's so much discussion involved. And I think it's a proven fact. There was another study done million years ago where they actually proved that during the consultations, the patients may, like they actually retain, I think, 20 or 30% of what you say,
Yeah.
and I try not to, I don't use the medical terminology. I draw diagrams and explain everything to them. So my patients are really well educated,
Mm.
and I help them come to the decisions. If they want to have additional consults, if they want to bring family members, I'm fine doing that also because the best patient is an educated patient, and that's my responsibility.
Right. Right. For women who have had I don't know if you just answered this, who have had a mastectomy, they have to wait. Is it a year, six? Well, what is it until they can get a reconstruction?
It depends on if they're undergoing chemo. If they're undergoing chemo, if they have to have radiation therapy,
Mm.
it's usually a better idea to let them do their radiation first.
Okay.
With implant reconstruction, I'll tell them, they should wait a good 3 or 4 months after chemo, 3 months, because their systems have to reconfigure.
Right. Right.
But I'm hoping, most of these patients are told they can do their reconstructions before they start all of that.
Wow. I think that's so fascinating. It's so fascinating. All right, we're gonna come back after a quick break with Dr. Stephanie Cooper coming up after the commercial break. So fascinating. We're gonna hear more though about you became how you got into plastic surgery and then your time in India and things like that. So we're gonna go deep.
Best.
And if you love what you're listening to, please subscribe to Secrets on whatever platform you listen to and never miss an episode. And help me get the word out. Share this with a friend. We'll be right back. Hi, everybody. I'm Jill Conway. Thank you so much for listening and loving the Secrets of Powerful Women podcast. If you could, please like and subscribe to my channel on Spotify or iHeart, Apple Music, Audible, and YouTube. It will help me expand the show and bring you more incredible women who are inspiring you with their stories. I am so grateful for your support, so thank you. Keep listening and share this with your friends. We're changing the world. Okay, welcome back, everybody. You're listening to Secrets of Powerful Women. Dr. Stephanie Cooper is with me, and she's a top plastic surgeon here in New York, specializing in breast reconstruction, but she knows her way around the whole field, plastic surgery field, and so many other fields. So, Dr. Stephanie, thank you again for joining us.
My pleasure.
And I wanted to talk about, we were talking in the break, but you have really gone through so many different types of schooling, and you said you initially you have a master's in psychology.
Yes.
So how did you end up like in the position that you're in? You spoke about it. Your dad was a plastic
Yes.
surgeon.
So when I went to college, I was way, way too young. I skipped 2 grades.
Wow.
It's kind of scary. I have a 163 IQ. It's like
Wow.
I was tested in high school.
God bless.
So I don't look at things and that's why plastic surgery really was perfect for me, because I had the opportunity to look at things and that's why I can take reconstructions. I do a lot of, like Mohs reconstructions when patients have giant defects in their faces. And I love like just general revision plastic surgery because I look at the puzzles, the puzzle pieces. I take them apart and I put them back together the way I want. And when I was a kid, I used to make my own puzzles because regular puzzles were boring to me. So I sort of, I guess you could say I
Right.
almost carry that skill set
Right.
into what I do now.
Right.
And I think probably the most important thing, and I know, we're probably going to talk about this later, but this is such an important point. I tell people, you know, in college or, my kids' friends, or you have to pick something that's sustainable. Don't pick something because of the money. Don't pick something because of the perks,
Mm.
because, things change. And do you see yourself doing this in 10 years, 20 years, 30 years? I've been doing this for 30 years and you could tell like I still love it.
It's
The
amazing.
operating room is my happy place.
Mm.
The other day I was operating at the hospital. And I've also done a lot of patients who have skin removal. They've lost 100 pounds, they lost 200 pounds, and I've invented my own procedures for those too. So I did a case like that, and then I also did a revision breast reconstruction. And I came out of the OR, I was so smiley. I literally smiled all the way home because it was just, for me, it was just the perfect day. Didn't have to deal with charts and
Mm.
paperwork, and I just got to do surgery, which is my happiness.
It's so funny because some doctors you meet after, they how long they've been doing it because they're kind of miserable and and cranky and you're like, why are they even a doctor? Like they don't even seem to care about their patients and stuff. But you are like the exact opposite. You're like, yeah, I get
I could not do anything else.
right, right. So you went to the, psychology and then you went through how many? I mean, what's the type of schooling you have to go through
So
med
I
school?
so I went to med school,
Hmm.
and then I did an internship. So I went to medical school in Mexico
Okay, wow.
because I never studied in college. I didn't care. I
Okay,
studied boys. I didn't
okay.
care about physics.
Yeah, but this is a great lesson because you don't have to find your purpose
No,
that young. You can,
my
right? Okay, go
purpose
ahead.
was to, my purpose was to date as much as possible.
Why not? Why not? But it didn't stop you. So
No.
go ahead.
So, and I think also another lesson that I can impart to younger people, because, one of my mottos is make that no a yes. So the more people who through my career told me, no, you can't do it, it just
Mm.
made me more determined to prove them wrong.
Right,
I've told my kids that, and, they're all
right.
successful. And, so that's important.
Mm.
So I did general surgery.
Mhm,
And then I did, because I had gone to school in Mexico, it was hard. I wanted plastics, and it was hard to get a plastic surgery residency. I wrote a whole bunch of papers,
mhm,
and it was funny. So what happened was the American Board of Plastic Surgery then decided that you had, because I was a foreign medical grad, and I did really well in school. I blew away all my
mhm,
exams,
mhm.
and I was like top 10% of my class. And I tried to transfer out, and I did really well on the exam to transfer out, and I had straight A's, but my college didn't send my transcripts out on time. So all my applications came back
Mm.
incomplete.
Um,
And, so I had to watch all these people who didn't have the grades that I did also on the standardized exams
mm.
transfer out. So I just turned it around and I said, okay, you know what? I'm going to make the best of this. And I
Right.
did. So I learned I'm fluent in Spanish. So I have a lot of Spanish speaking patients.
Wow.
My kids are fluent in Spanish.
Mm,
So, you sort of
mm.
take your lemons and
Yeah,
make
of
it
course.
into lemonade. So the American Board of Plastic Surgery decided that you had to you had, if a foreign med grad had to do all their general surgery years in the same program. So that no longer applied to me because I did half my training in Chicago, and then I finished up my training right here at North Shore, which I love.
Wow. Wow.
And so I did a head and neck fellowship, and I was going to go the ENT route.
Hmm.
And wrote, and all the while did like a lot of papers and stuff like that. Then I had a ding 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 moment where I said, wait a minute. I contacted the American Board of Plastic Surgery, and I said, as of when was that ruling? Well, the ruling was as of July 1st, 1986. So I told them, I go, well, I officially started my residency on June 25th.
Oh
I
my God.
had I had my first paycheck stub and my first operative summary that I ever did dated June 25th.
Wow.
So I sent that into the American Board of Plastic Surgery, and they said you're exempt from the ruling.
Wow. Good for you, right?
Yep. So then I ended up getting a job, and this was kind of funny. So I was like, and there's always like a year lag between the time that you apply for plastics. And so I was like, what am I going to do? So I go up to Westchester County, and they have a pretty well-known burn fellowship up there, burn and plastic surgery.
Mhm.
And I applied for it, and the person who was running the program was awful to me, and
Male or woman?
just
Man or
yeah,
woman?
he was so nasty.
Mm.
But what I did was I sent him a gracious thank you email afterwards. Thank you so much. It was wonderful to meet you.
Hmm.
And they accepted me into the program.
Oh my God. That's funny.
So I published a bunch of papers, and I was determined to get into plastic surgery. So I applied to every program in the country. And I had like 8 letters of recommendation, and they changed the rules and they only wanted 2. So what I did was I would stay at the hospital typing up envelopes, and and stamped envelopes, so that all the other attendings who I wanted to send their letters in could just print them out, pop them into the envelopes and send them. And
Hmm.
then what I did was I printed out all the papers that I've written over the years and sent every single program a packet of my papers.
Wow.
And I got like 12 interviews, and I got into my top choice.
Wow.
Dallas.
That's fantastic. So you went there.
I went there. I loved it. And then I went into practice with with my dad and my brother. And my brother is a plastic surgeon too. And then
Wow.
he left, he moved to Delaware. We were the only father, son, daughter team in the world. And
Hmm.
we called ourselves Generations Plastic Surgery. And my father had a big bronze plaque. We were on 80th and Park. And he had a big bronze plaque made up, and we had an unveiling, and my mother cried. It was so cute.
That's nice. Oh, that's so nice, though. That's wonderful. So, how was it? Um, how was it to be a young female plastic surgeon? It must have been
So
tough
I had, um,
because it was predominantly men at that point. Still.
oh yeah, I was the 13th boarded female plastic surgeon in all of New York, not just New York City.
Wow.
So
Okay.
there were not many of us at all.
Mm.
But, by that time, having gone through a general surgery residency, I was pretty outspoken. And I remember there was this one attending who was so nasty to me. He just used to scream at me, and the nurses used to call me Dr. Cool because he'd scream me through cases, and I'd look at him and I'd say, "Are you done yet?" And I never, and another thing also, like being a female in a man's world, you never let him see you sweat. That really is. So
Hmm.
I would just smile, and, knowing that I was accomplishing more than they ever could think about accomplishing. And so fast forward, I'm an associate professor of plastics, which gave me the privilege to be able to, play a role in choosing future residents for our program, future fellows. So we're sitting around the big conference table, and there was this one candidate that I just couldn't stand. and I'm a pretty good judge. I can size people up within minutes. And I just spoke out against him. So this attending stands up. And in the meantime, I had all these job offers when I finished my residency. So no one had anything bad to say about me.
Mhm.
And so he stands up in front of everyone, big giant, all the attendings are there. And he points his finger at me. He goes, I don't know why anyone would listen to you. I wanted to fire you years ago. And I had already passed my boards. So it wasn't like he could call them up and say, oh, she's awful.
Right.
And I stood up and I pointed my finger back at him and I said, listen, you miserable fat clown. No one cares what you have to say.
But why didn't he like you?
I don't know.
Yeah.
You know what? Every year he would pick a resident that he hated.
Mm.
And, why they even allowed him
Mhm.
to, you know, to teach residents. He taught me
Mm.
how not to do procedures because he was awful.
Mm.
And, and attendings were coming up to me afterwards and saying, I don't know why he's always spoken poorly of you. We love you,
Mm.
and the fact of the matter is I did get a lot of job offers from attendings that I worked with when I was
Mm.
a resident. So
Right.
that tells you all you need to know.
Right. You
Um,
told me a story about how they wanted you to wear dresses or what was that? Tell us that story.
so, if you look at old doctor shows, the nurses all wore, it's kind of the equivalent of scrubs, like the green scrubs that we
Mhm.
wear, but they were dresses
Mm.
with snaps up the sides and they came to just below the knee. So we were supposed to wear dresses, scrub dresses in the OR, and I refused.
And I mean, it just seems so crazy to me that they were still requiring this.
Yeah,
In what,
it
the
was
80s? When was it? The
in the
90s?
It
It's
was
just
pretty remarkable,
because somehow that mattered. Right?
right?
Somehow that mattered.
Because you know what it did is it brought us down a rung. We
Mm.
weren't, we weren't equal
Right.
to our male counterparts who, had their locker room and they were hardy har harring and patting each other on the back. It was definitely a almost like a brethrenship that I
Mm.
didn't have. It's funny because I was really good friends with the nurses and they saw how I was treated and they took me under their wing and they were so, they would call me up and they would just say, look, this is what happened last night. I started the IV. I didn't want to wake you up. They were so
Mm.
nice to me. I
Right.
had this chief resident. His name was Dominic Toletano, and he was about this tall. And he took it upon, and I was the only resident in the entire group of all of us interns and residents who had to call him Dr. Toletano. And he was a chief resident. He wasn't an attending.
Mhm. Mhm.
And he would call me into his office and tell me I was a failure and that I would never amount to anything and that I was awful and I was stupid. And I would just sit there and go,
God.
and finally, and I was so afraid that I was going to lose my job because I think so many women who have risen through the ranks, that's a fear.
Mm.
So I took his guff until April. And this was the first time when I realized I was no longer going to take grief
Mhm.
from men again in my
Right.
profession. So where, it was part of University of Chicago and all the attendings were there and the medical students and the medical student is presenting a case and Dominic turns to the medical student and goes, hold on a minute, turns to me and goes, in front of everyone, blink, Cooper, blink so I know you're alive. And I looked at him and, I don't curse, like I just don't, but
Mhm.
that just warranted it. And I looked at him and I went, F you, Dominic, and your mother. And I turned around and I walked away. And
Wow.
he comes storming after me. Don't you turn your back on me. And I just kept going. I took the rest of the day off. And after that, he was nice.
He
So
wanted to be right. He
40 years later, he tries to contact me on Doximity. And I responded to him and I said, remember what I said to you in 1987? That still stands.
No. Oh my gosh. Well, because where did they think they could just speak to someone like that? I think it's not probably your profession, it's all these professions where,
Yes.
they it was predominantly male and they didn't have to deal with the women with women counterparts.
Look, you even look at old yearbooks,
Mhm.
and it was so funny. Like, you look at old yearbooks from the 70s and from the 60s, and when you look at what the professions that the women wanted to go into, they wanted to become housewives
Mhm.
and mothers, and that never entered my mind.
Mm.
But that's what the men were used to.
Right.
They're used to the women who have to ask their husbands to have plastic surgery,
Right.
or I've just never been that kind of person at all.
Well, was it because in part like your father supported you and encouraged you? Did he to go into?
You know what? He didn't encourage me to do plastic surgery. But of course, he was proud and happy that I became a doctor and I
Mhm.
was like his buddy and he was my mentor.
Mm.
And actually, I have a funny story about that too. So I was a young attending. This was in 1999.
Mm.
Passed my boards. Everything was good. Top of the world. And the first breast augmentation done through an abdominoplasty was done by me in
Wow.
1999.
Mm.
So, because it just made sense. I had an African American patient who didn't make great scars, and I didn't want to put a scar on her breast
Mhm.
for a breast augmentation. So I figured it out. The anatomy, I figured out the anatomy, and there was a thing called a space saver. And it was basically a tube attached to a balloon. And we were using saline implants at the time. And the
Mhm.
balloon happened to be the same shape and size as an implant. So I was like, if I could figure out how to get the space saver up through the tummy tuck
Mm.
underneath the muscle, I can pop the implant in that way. So I figured it out. The first side took me like an hour and a half
Mhm.
because I had to figure it out. And then the second side took me 20 minutes. So the patient looked great. It worked.
Mm.
And I actually put her in my Instagram too. And so, of course, lo and behold, they have the big plastic surgery meeting, the weekly meeting, and I was the highlight of the meeting because the patient was under anesthesia for like 6 hours doing a cosmetic case. So I got up there and I knew that, and I think there was one woman in the entire audience who was like one of my mentors. So she was not going to get on my case. And she was also
Mhm.
really good friends with my father.
Mhm.
So I'm standing there at the podium and they're going at me and I'm just listening. Like, and at the end, I just said, you know what? You're all pissed off because I came up with the procedure and you didn't. And granted, there was a learning curve
Mhm.
because none of you did it before. So I had no
Mm.
papers or videos or anything to go by. So I came up with the procedure. And you're angry that I did it and you didn't. And if I have any other patients who would be perfect candidates for this procedure, I'm doing it again, whether you like it or not. Does you know, does that Are we done here? Does anyone have anything
Right.
to say? My father starts laughing out loud. And I got off the little podium and sat back down, never heard anything about it again.
Oh my god. But I'm wondering though, because you are outspoken and that takes a lot of guts to get to where you are and blaze that trail. So how did you do it? How were you able to do it?
I'm very determined and I'm very out of the box and I love challenges. Like that's why I love
Mm.
revision surgery because nothing is more challenging than that.
Right.
And I just, take these basic tenets that, by which I live my life and it was a perfect example of using everything I know and my basic personality. I'm very strong-willed. I don't take orders very well. I make my
Mhm.
own rules.
Mhm.
And I think you have to, to some extent, you have to be like that in order to forge ahead. I've always been very goal oriented.
Mhm.
My whole family, my friends, they call it Cooper on a mission.
That's funny.
And it's true.
Yeah.
It's like when my kids know mom is on a mission, there is there there is nothing that's going to hold me back from accomplishing what I want.
I love that. Well, speaking of mission, you went to India for a
Yes.
time on a mission, on a missionary trip almost, you know.
Absolutely.
So what did you do there? Tell us about that.
So when I was a plastic surgery resident, there was an attending that I became very attached to. His name was Dr. Sharad Dikshit, and he was from India. And the man had 9 lives. Like, they've written books about him in India. So he established 62 clinics all over India, and he had been doing this since the 60s.
Wow.
And so I had the opportunity. He invited me to come and join him to operate in India. We were operating on poor children
Mhm.
who otherwise, they were shunned by their villages, their families were shunned. So basically, a lot of them had cleft lips,
Mm.
other facial abnormalities that we could fix. And for example, I did 120 surgeries in a week.
Wow.
And I figured out my own way of doing the cleft lips, and I was doing them in 15 minutes because we weren't doing them under general anesthesia because we didn't have the facilities.
Mm.
Sometimes we had a hospital that would
Mhm.
volunteer their time. Other times we had 2 cement slabs and a dangling light bulb. But you just figure it out. And
Wow.
anesthesia would volunteer there, depending upon which villages. And I
Mm.
traveled because I went to India twice. And during those 2 times, I performed surgeries in like 8 different cities all over India.
Wow.
So I remember there was this one little boy, and people come, they walk for days to get to our clinics. So we'd spend the first 2 days screening patients. And it was sad because the parents would bring their children all dressed up, and they'd have like kohl around their eyes that's supposed to make them more attractive in the hopes that they would be chosen to have surgery.
Oh, wow.
But we did have our criteria because clefts are oftentimes associated with other, or like heart abnormalities, kidney abnormalities.
Mm.
So, we didn't operate on very, very young infants. Our cutoff was like 2 years of age.
Mhm.
So we knew that if a child in these villages that had no running water had made it to 2 years of age, then they were healthy enough to undergo their procedures. And I remember, on the way, because we didn't really get any funding, I was calling, suture reps, and I was walking up and down. I was a resident, walking up and down Park Avenue, knocking on plastic surgeons' offices and asking for donations of sutures. So I went down there, whenever any of us went down there, we went with a suitcase of stuff, local anesthesia, like everything. So there was this one little boy, he's about 10 years old, and he walked around with a rag on his hand and he covered his face like this. And he had the most beautiful, like almond eyes. He was beautiful. And you know that he would have been so beautiful if he didn't have this cleft. And I asked Dr. Dikshit if I could perform this little boy surgery. And so there were no dressings or bandages. You do the surgery, you put antibiotic ointment on, and then we would wheel the patients into these like these big rooms where they would recuperate there. And then after a few days, they'd walk back to their villages. So when I did this little boy surgery, and as we were wheeling him out of the operating room, his mom was there, and his mom looked at him and went, because she had and everyone cried, including me, because she didn't have a conceptualization of what her son would look like normal. And what was so amazing about this experience was that, cleft people in India tend to marry other cleft people. So the risk of their child having a cleft is 100%. So we changed the statistics by performing surgery because now these children go back to their villages, they heal, and they look normal. So they can have normal lives. Their families are accepted back into society and they can marry a non-cleft woman or man.
Right.
So now the risk is down to 25%. So it's pretty remarkable.
Wow.
The second time I went, I invited my father to come with me.
Oh, how
I went
nice.
in December. My father's birthday was in January. I said, "Pop, what are you doing for your birthday?" "Oh, I don't know, probably staying home."
Mm.
I said, "No, you come into India with me." And we worked side by side. And and so we're in India, and it was just it was so memorable. And my father and I, we had matching cement slabs with the dangling light bulb. That's like where we were
Mhm.
at the time. And I remember these Indian plastic surgeons came in, and they would come in and they would watch us. And I remember saying to them, "Why don't you glove up and and help us with these little children?" But they were not interested because they weren't making money. So I kicked them out of my OR. I said, "Then get out of my OR. I'm not going to teach you how to do this for your rich patients. Out."
Oh,
And it was
wow.
written up in the local newspaper, this horrible American, but I didn't care. And to her credit, one woman came back and she helped me for the rest of the week. And then she promised to follow up with the patients once we had left. So, we were able to change the mindset of one of these doctors. Later on, the group was nominated for a Nobel Prize.
Oh.
So we went to, but it's political. I
Mhm.
think Coffee Annan, no, yeah, Coffee Annan won the year that we were nominated. And we certainly could have used the money because, this was all self-funded. And, we got some backing from the Lions Club, but mostly it was funded by the participants. And so I said to my father, I go, "So what are you doing for Father's Day?" He goes, "I don't know,
Mhm.
probably staying home." And I said, "Well, you coming with me to Norway?" So we traveled to Oslo, and we were in Oslo for like a week, and we went with our grant person
Mhm.
who did the grants for our group, and the business guy. So it was my father, the business guy Murph, the grant guy, and me. And we went to the Nobel Institute and we presented our work to Dr. Geir Lunderstadt. He was the tallest man I've ever seen. And he took us into, the big conference room where they make the decisions, but, we didn't win, but it's all right.
Oh, 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 man.
But
What?
it,
That's too bad. That's too bad, though. You know, I love these stories. I love all the stories. Let me ask you this: for women who want to go into the medical profession now and go into plastic surgery, I mean, it's very different than when you started. But what advice would you give them?
pick a field that you're going to love 20 years from now, because everyone knows insurance reimbursement is not what it was. You're fighting, they deny claims. But would I still do these procedures even if I didn't get paid? Yes.
Mm. That's
I think
lovely.
that's, don't go into medicine because of the money, don't go because of the fame or the adulation, because, that's getting to be
Mm.
less also. And, and a lot of medical fields are being replaced by, you know, PAs and nurse practitioners and hospitalists. Medicine is not what it was. And doctors are not held to the same, I guess they're not revered like they were,
Mhm.
where, so, if someone is going to go into medicine, they have to accept the fact that, the way doctors are regarded, for the few bad ones out there who get all the publicity.
Mhm.
You hear stuff on the news all the time. This doctor did this and this doctor did that. So you have to pick your field. The choice has to come from within, not from, the things that you're going to gain from being a physician.
Mm.
It really is a calling.
Mm. I agree with you. I agree with you.
So
Are you?
you had
Go ahead.
mentioned before, during when we were on
Right.
pause,
Mhm.
is there a case that really resonated with you?
Right. that you remember. Yeah.
So, every now and then you get a case where you say, you know what? This is why I was led on this path. So there was a little girl, and she was 11 years old, and she was in the Columbia Presbyterian ad for having this weird rare cancer. And and she couldn't pronounce Columbia Presbyterian. She was just so adorable, and she was so
Mhm.
brave. And I just, it's like I just felt, it's like you fall in love with her. Like, she's
Mhm.
just so wonderful. So, and every now and then I would check to make sure she was okay, because I just wanted her to be okay. So fast forward, it's my first year working with Dr. Greenberg. It was COVID. We were wearing masks. Once we were shut down for a while,
Mhm.
because, no one was doing, you can't do cosmetic surgery when people are dying.
Right.
So we were shut down for about 4 months. And then, so probably about 7 months after, we're still wearing masks, still taking the precautions. And this girl comes in, she's 20. She comes in with her, or she's 19. She comes in with her mom, and I didn't see the face. All I saw was this.
Mm.
And she's talking, and and I'm listening to her voice, and I was like, wait a minute. Are you the little girl from the Columbia Presbyterian ad? And she goes, yeah, that was me. And she had come in to get a reconstruction of her whole abdominal wall so she could feel normal again.
Wow.
And I remember saying to the girl, and she was going to college. She was working as an EMT,
Mm.
and she wanted to go into a medical field so she could help other children like she was helped. Just one of the most special people I've ever met in my entire life.
Mhm.
And so I remember, so then I said to the girl and her mom, I used to check up on you to make sure that you were okay. And now you're
Mm.
standing in front of me. It
Mm.
really was unbelievable. So I did her surgery. I don't even know if I got paid. I don't care.
Mhm.
I just wanted to do it.
Yeah.
And I really called upon every single thing I've ever learned in plastic surgery to reconstruct her belly wall. And that summer, like that summer after that, she wore a two-piece bathing suit.
Wow. For the first time probably ever,
First
right?
time.
Wow.
And that she's still, she has since passed from, like,
Oh.
other medical issues,
Mm.
but she was so brave, and she resonated with me. I was like, I loved her.
Mm. Oh.
And, so that she was very special.
Yeah, that's that moving story that you'll probably always take
Always,
with
and it
you.
brings tears to my eyes.
Yeah.
Just it's one, and I was like, "You know what? This is why I ended up back,
Mm.
this is why I didn't leave."
Right.
It was supposed to happen that way.
Right. Well, where do you see yourself in the next, like, 5 years? Is there a you're obviously gonna still be doing what you're doing,
I'm
right?
never gonna retire.
Right. Right. Well,
As
you
long
guys
as I can, as long as, and I don't see it, like, in the next 5, 10 years not being fun anymore.
Mhm.
So, I said to Dr. Greenberg, I go, "I guess you and I are growing old together."
And you have so many offices, everywhere, so you
Yeah,
could
we're all
kind
over
of
the place.
yeah, you could do that snowbird doctor thing. You could if you wanted to, you know? I do want to say a quick thing. You are a military mom. Your son
My son,
is
he's
serving our
deployed
country.
now. But
Yeah.
he's, I'm not allowed to say where, because he's like special forces intelligence.
Okay. But
But, what was amazing was, it was something that he's always wanted to do. And, I used to kid him and say, well, you couldn't have decided to do that before I paid all your tuition.
well, the college, right? Yeah, yeah.
So I went to his graduation from boot camp, and it was amazing. Like he
Is
became
he Army? What is he?
Army.
Army? He's Army. Oh, how nice.
And he's coming back at the end of July. He's been gone for a number of months,
Mhm.
but you know what? He loves it. He was the only kid who went through boot camp and they do that gas mask
Oh, I don't
test.
know. Okay.
And he was the only one who came out like laughing. Everyone
Oh,
else came out sick and coughing, and he came out beating his chest and going, "Woo!"
oh my
He
goodness.
became platoon leader. On his deployment, they just made him a sergeant. So very,
Uh,
very, and you know what's so funny? When we're, when we're younger and we're pregnant, you see every pregnant woman on the street.
right.
And, my other son has 9 HVAC companies.
Wow.
So when he first went into that, he had a mergers and acquisitions startup, and his company made it. And so then I was seeing every HVAC truck on the
Mm-hmm.
street. And so now I've gone up to people at the airport and they probably think I'm weird. And I'll look at them and I go, "Are you in the military?" Because there's just something. And you know what? 10 times out of 10, they're like, "Well, yes, I am." There's something about their carriage, about the way they present themselves to the world. It's really, it's amazing.
Mm. Oh, well, so are you, and I think that's wonderful that that he's serving our country,
Oh my
and
God.
that's a
So
testament to him. That's a testament to you, and it's a wonderful, wonderful thing, really.
proud mom.
Definitely, and we want to say God bless to him. We hope he stays safe,
Thank
and
you.
he's got a great mom here too. So I do want to say, Stephanie, thank you so much for coming on. I think it's time.
This was amazing.
Thank you. I appreciate it. It's time to wrap up. But again, a big thank you. She's part of the Greenberg plastic surgery practice. Are you in a certain office, or you travel to all the
I am
offices?
in Woodbury and Smithtown.
Oh, very nice. Very
So
nice.
if anyone is interested, they can call the office and ask for Diana. She's my coordinator, or
Oh,
Carla.
very nice. All right. Well, Stephanie, thank you for coming on the show and sharing
Oh,
your
my
incredible
pleasure,
story.
Jill.
This was
Wonderful.
This was wonderful. It was wonderful. So I'm Jill Conway. Thank you for listening to the show celebrating incredible women like Stephanie. And I hope you're inspired to pursue your own goals, believe in yourself, and dream bigger. Your voice matters, and your story can help others. I hope you join me next time.
You're amazing. Thank you.
Thank you. Thanks, Stephanie.
Bye-bye.
This show is sponsored by Jackie Mahali Photography, where personal branding photography and video help women entrepreneurs over 40 feel confident, beautiful, and seen. Start getting paid what you're worth. JackieMahali.com when it's time to elevate your brand and your image.